Hi, this is Linda Watson with Cook for Good. I'm here at the Volunteers in Medicine Clinic in Hilton Head, South Carolina. We've just had a terrific class, and I'm here with Dr. Frank Bowen, who's the director of the clinic.
Medical director, yes.
Medical director. Well, thank you so much for having the class here. And tell us a little bit about what your clinic does.
Volunteers in Medicine has been open about 16 years now.
Fantastic.
We have a few more than 12,000 active patients, about 30,000 patient visits a year. And we have about slightly over 100 volunteer physicians, most of whom are retired, and about 90 volunteer nurses, about 400 lay volunteers, and we have nutritionists, we have mental health counselors, we have about 30 dentists, and all of these people volunteer their time.
That's fantastic. And people come in here and it's paid for with Medicare or just volunteer
No.
work? How do you fund it?
We don't charge the patients at all.
Fantastic.
It's a free clinic. The clinic is supported by donations. About half of our income comes from donations. About 30% of our income comes from grants.
Good.
And about 20% from fundraising events like golf tournaments and things like that.
Yeah, because Hilton Head is really beautiful. This would be a great place to come for a golf tournament. Tell me a little bit about some of the nutrition work that you do here.
Well, we see a lot of patients who have chronic disease, such as diabetes and hypertension and thyroid disease and asthma. And nutritional counseling and education is key to the management of chronic disease. All these patients are in what we call disease management. So they're treated by a small whole number of physicians, nurses, educators, nutritionists. They see the same people every visit,
Right.
this small group of people, so that this kind of counseling is integral to it. Disease management means that you have this disease, I don't.
Right.
So my job is to teach you how to manage your disease, not depend on me trying to manage your disease. That means you have to manage your whole lifestyle. And
Very good.
lifestyle is not just taking your medicine, it's how do you eat, what do you do, how do you exercise, and so we work with all those aspects.
That's fantastic. And you were just telling me some really interesting work that you're doing with childhood obesity and how important it is to prevent it early.
Well, we're trying to start with that. We don't have a lot of data on childhood obesity, except that it's an epidemic form in the United States right now. We think that the best way to treat it is to prevent it.
Yes.
That's our thought. But we're also going to try and work with children who are significantly obese and see whether we can decrease their rate of weight gain. We don't want them to lose weight. We want them to not gain so fast.
And I had never thought of it that way, but that's fantastic. You grow into your weight and then everything's fine.
Well, if you think about it, in the United States, we have somehow become the world's consumer,
Yes.
number one. And the second thing is, somewhere around 1900 or so, we sat down for the first time. It was called the automobile.
Yes. Yes.
And then in the 1920s, we sat down for the second time. It was called the radio.
Yes.
In the 1950s, we sat down for the third time. It was called the television set. In the 1990s, we sat down for the fourth time. It's called the computer.
Exactly. Yes.
And if you have to go to a store that's 6 or 7 blocks from your house, chances are you'll get in your car and drive there
Yes.
instead of walking there. When you get to the store's parking lot, you'll spend a good quantity of fuel driving around so you can get a close space.
Yes.
And if you're in South Carolina, close space also means that you're going to be parked in the sun. We tell you to go to the furthest spot from the store.
Yes.
It's the edge of the parking lot. You don't have to look for a space because nobody else is parked there.
Right.
Nobody's going to open their door and ding the side of your car because nobody's beside you. That's where the trees are planted, so you can park in the shade and you get a little bit of exercise walking back and forth.
That's a great tip. I love that.
See, it's
4 in
simple
1.
things like that that we try to work with people in terms of lifestyle management. And nutrition is a part of lifestyle management.
That's fantastic. I love the work you're doing here. If someone wanted more information about the clinic and how to get involved with it, maybe even how to give you a little bit of help, how would they find that out?
Our website is the best way, vimclinic.org.
That's vimclinic.org.
Yeah.
Well, thank you so much for talking to us today. I really appreciate the great work that you're doing here, and it's a pleasure.
Thank you for coming.
Very good.
Appreciate
Thanks.
it.
This is Linda Watson for Cook for Good. Thanks for watching.